Welcome, everyone, to another edition of SCRC's Let's Talk Caregiving. I'm your host, Roberto Velasquez, President and CEO of Southern Caregiver Resource Center. And I'm here, as always, with my co-host, Marta Rañón, our Executive Vice President. Hi, Marta.
Hi, Roberto.
For today's podcast, we have a very special guest by the name of Victor Ruiz. Victor serves as a health promotion specialist and partner relay program liaison for the County of San Diego Office of Border Health. Victor leads efforts to strengthen emergency preparedness communication among multilingual and at-risk communities by coordinating a network of trusted organizations that include both government and nonprofit organizations in the county. I want to welcome you, Victor, for joining us today.
Thank you. I'm excited for being here, and thank you for the invitation. It's been a long time since the last time that we saw each other, so I'm very, very happy to see you again now talking about this topic of emergency preparedness and what our communities can do to be safe.
Victor, we are glad to have you here as well because, as you know, our community of family caregivers often has a lot of challenges throughout their days, throughout their lives. And now, thinking about the added challenge of emergency preparedness,
Mhm.
that is something that, as caregivers, we really have to think about and prepare, especially because of where we live, right? We have
Right.
had floods, we have had fires, we have had earthquakes, and sometimes the weather is unpredictable. So, talking about how we can prepare as not only individuals, as San Diegans, but also as family caregivers is
Mhm.
really, really important. So, welcome, and I'm glad that we're here to talk about this.
Of course. Thank you for having me.
So, Victor, so happy you're here because, preparing for a disaster is sometimes complicated, especially if you're a caregiver and you're providing care to somebody who's frail, elderly, somebody who might have dementia. And the recent fires were terrible. There was, so much destruction. People had to they were displaced. People had to move. People had to be evacuated. People were on edge, not knowing what to do. And now, if you have to get out yourself, that's one thing. But if you have to evacuate or move quickly to some situation, and you're caring for somebody, and you may even have pets that you're having to work with, maybe service animals. I mean,
Mhm.
what are some tips that you could share that might be helpful to the thousands of caregivers here in San Diego County?
Thank you, Roberto. Well, first of all, I think that you were able to summarize the intro perfectly. Yes, San Diego County is prone to wildfires, flooding, and earthquakes, and all of this can disrupt caregiving routines and also create major challenges for those with special needs or mobility needs. Now, when we're talking about caregivers, planning ahead means thinking about, like I mentioned, the specific needs of the person they care for. And this can include medication management by having an up-to-date list of prescriptions and extra doses on hand. When we're talking about medical equipment, we need to ensure that we have backup power for all devices like oxygen machines, wheelchairs, etc. It's also very important to take into consideration our personal documentation. It's important to keep copies of our medical records, insurance information, and emergency contacts. And right now, the goal for us should be to be proactive instead of reactive, because as we've seen in the LA fires, the San Diego fires, and or the January flooding that we had on 2024, emergencies happen fast, and we experienced flooding in areas that didn't flood in the past. Um, so it's not a matter of if an emergency will happen, it's a matter of when. And that's why it's so important for us to start being prepared as soon as possible. And these are some of the three, I guess, tips, that, or the basics, right? And understanding your local hazards as well, knowing, okay, in which area of San Diego, or in this case, if we have someone who's not from San Diego and is listening to this podcast, is what does my community look like? What are the local hazards? Is my community prone to wildfires, to flooding, etc.? So that those should be some of the basics for now, and we can also talk a little bit more on having an emergency kit, right? And I think we can address that, in just a couple of minutes, because that's also an important component in itself of emergency preparedness, having a go kit, for our caregivers and the person that they are taking care of as well.
Victor, I'm so glad that you mentioned those tips because we teach a class on emergency preparedness. And of course, we focus 100% on the family caregiver. And we do encourage people to really become familiar with
Hmm.
their environments, their communities, right? I mean, having a blizzard, it's probably not going to be something that we are facing, but now we know
Hmm.
that fires and flooding. Definitely. And so being aware, where are those evacuation sites? What are the routes? Where are the resources that we can access? If we live in the city, how quickly can we get to those emergency shelters? If we live in a rural area, what are the roads that might be blocked? And therefore, how can we find alternate routes? It's important to make a plan and not only make a plan of where to go, but who you can call on to help
Yes.
you. If there is a neighbor, if there is a friend, and you are a caregiver and you have someone who has a limited mobility, maybe you can say, "Hey neighbor, I'm caring for my grandmother and she's in a wheelchair. So if we have to evacuate, would you please come and help me at least get her into the car so that we can quickly leave?" So those are parts of the plan. If you have pets as well, right? Some people have pets that are service animals. And so that is also needing to be taken into consideration. Food and water for the pets, for yourself, for the person that you're caring for. That's why it's important to plan and build these kits that you're talking about, but really have this accessible so that there is a quick getaway plan, a quick network that you can access should you find yourself in an emergency situation.
Right.
To elaborate a little bit more, when we're getting this information, these emergency alerts, most of us get it from television. The news, the streamline that says emergency, or the emergency sound that comes out, and then there's the evacuation notices, or be prepared, or you're on alert for potential evacuations. But when you're providing care to somebody with like Alzheimer's, and they're listening to news that sounds like that, it could be awfully frightening for them, because they're not processing the information like normal, like we would, right? Because they have memory loss, they have dementia, they might start hallucinating a little bit, or having some behavioral issues because of what's happening. So it's important to maybe have another method for getting this information. And I know there's resources out there. Wonder if I think there's one called calalerts.org, which is an app, I think, that you can download, and you can have that kind of emergency response kind of preparedness information for you. Do you have other resources that people might want to use that you're aware of, Victor?
Thank you, Roberto. Yes, fortunately, here at the County of San Diego, we have official information sources, where you can receive alerts. These alerts have been vetted by the County of San Diego, vetted by the Office of Emergency Services. I collaborate hand in hand with the Office of Emergency Services, so I receive these alerts and I manually redistribute these alerts to our network of community-based organizations to ensure that the people who are being served by the multiple community-based organizations really receive the information in a timely manner, reshare it, and also I serve as a liaison for these organizations to reach out if the official communication needs further adjustment, or if there are any details that you're seeing in the community. Usually what community-based organizations do is to elevate that information back to me, back to us, and then we relay back any updates during the emergencies. Now, when we're talking I think that right now the main topic, or the underlying topic of this portion of our conversation, revolves around communication, right? The importance of having a communication plan, to be informed, where to be informed. And to answer your question, here in San Diego County, we have a local alert system. This system is called Alert San Diego. This is a website that people can access. And all the information related to emergency preparedness locally in San Diego can be found in this website, because it's divided in 3 sections. You have the preparedness portion, where you will find information on how to access your personal disaster plan. It's available in 12 languages. We have the digital versions of these personal disaster plans online. People can also download an app. There are multiple apps in San Diego County. The main one, the official one, is the SD Emergency app. This app is available in English and Spanish as well. And most recently, a new app was incorporated into the spectrum of emergency preparedness apps, and it's called Genesis, with a Y. It's Genesis Protect. This app also provides you a map if there are any road closures, evacuation sites, etc. And it's a great resource to incorporate into the local apps that exist.
Victor, I also wanted to talk about the kits, because
Yeah.
there are two types of kits that we often see. One is the kind that you can just buy, right? You can
Hmm.
buy it at a store, you can buy it online, and it usually comes with basic um, items like gauze and wipes and
Hmm.
band-aids. But then there are also the kits that you can make, and this
Yes.
is where I want to make sure that our audience understands you can certainly buy a kit at the store and then add to it. It doesn't necessarily have to be that. You can just grab a backpack. You don't even have to
Hmm.
buy something that's already there. You can just
Correct.
fill it with the things that you need. If the person needs specific medications, make sure you pack those and you keep them updated. If the person has, sometimes has low glycemic levels, then make sure you take snacks that are going to help if in case of an emergency, ample water, food and snacks, but also things like maybe you need hearing aids, maybe you need glasses
Mhm.
that need to be packed as well. Any other tips on that, Victor?
Of course. And very quickly, a basic emergency preparedness kit should have enough supplies to last at least 72 hours. Some of the key items include non perishable food, water and hygiene products, first aid supplies, and a flashlight with extra batteries, cash, ID copies, and a list of emergency contacts. Also, for caregivers, it's important to customize the kit based on the care receivers' needs. This might be extra medication and medical supplies, mobility aids, and also consider comfort items for those with cognitive or sensory challenges, like noise canceling headphones or familiar objects. And one last thing, ensure that if you need to evacuate quickly, that you have a kit close to the door or in your car as well.
Thank you so much, Victor, for sharing those final tips. This is really important. I think the biggest message today is to plan ahead. You can't grab all these things when you're being told to evacuate. You have to have
Mhm.
these things prepared. And the other thing that I think is really important is to practice your evacuation. I think,
Right.
like we used to when we were in school, remember, practice the earthquake drills and everything like that. There's a reason for it. You practice these evacuations so you know where to go. And sometimes the planning is so important because the people that you thought you could rely on might have to be evacuated themselves. So it's good to practice. It's good to have the plan, and it's good to have all the items that you said in the toolkit. Thank you so much, Victor, for joining us.
Oh, thank you so much for having me. Again, all the information that you need to be prepared to receive the alerts and also to find out additional information if you've been affected by a natural disaster. All this information is available on Alert San Diego. It also has the Google Translate function. So you can also select your language, and the whole website will translate into more than 100 languages. So it's a great resource. Use it. It's available for all of us.
Thank you, Victor.
Well, that's all the time we have left for this edition of Let's Talk Caregiving. To hear more of our podcasts, follow us on your favorite podcasting platforms or visit our website at scrc.care. I want to thank Martha for co-hosting another important discussion, Victor Ruiz for joining us today, and our audience for tuning in. If you're providing support to a loved one, you don't have to do this alone. Asking for help is not a sign of weakness, it's a sign of strength. To connect to our programs and services, visit our website at scrc.care or call us at 1-800-827-1008. If you live outside of San Diego and Imperial counties, visit caregivercalifornia.org to find the Caregiver Resource Center nearest you. To support our efforts and make a tax-deductible donation, please go to scrc.care and click on the Donate tab. And remember, SCRC is here for you, caring for those who care for others.